Good afternoon, everyone. I'm Jessica Altman, Pennsylvania Insurance Commissioner and Chairwoman for the Board of Directors of Pennie. I am joined today by Governor Tom Wolf, Pennsylvania Department of Human Services Secretary Teresa Miller, and Pennie's Executive Director Zachary Sherman. I want to thank you all for joining us today. In terms of healthcare in Pennsylvania, we are here to talk about two things. First and foremost, that the first deadline in Pennie's open enrollment period is tomorrow, December 15th. This is the last day that consumers can enroll in coverage that begins on January 1st and have coverage for all of next year. The second being the importance of having health insurance and how with Pennie, the new state-based marketplace, getting the right coverage at the right price is even easier. I'd now like to begin by turning it over to Governor Wolf, who we truly appreciate attending today, and all of us are so glad to see you feeling so well, Governor. Thank you.
Thanks, Jessica. Thanks, Commissioner. I really appreciate that. Thank you for doing this. This is an amazing thing for Pennsylvania. As you know, I believe Pennsylvanians have the right to accessible, affordable, and quality health care. So I'm really proud to be right here today with you to highlight the important work that's being done by you and your team, working to make sure that Pennsylvania's own insurance marketplace, known as Pennie, which is really making a big difference, and it gets the recognition that it deserves. Pennie is the one-stop shop for Pennsylvanians' healthcare needs, and it includes a reinsurance program that will lower, actually this year, starting from year one, lowers premiums for individuals and families who buy comprehensive coverage. This means that more Pennsylvanians will be able to get affordable health insurance. More Pennsylvanians will be able to see a primary care doctor for preventative care. More Pennsylvanians will be able to manage chronic conditions. And crucially, more Pennsylvanians will live healthier, longer lives. That's what all this means. Improving access to healthcare has been a priority for my administration from day one. And you, Commissioner Altman and Teresa Miller, you have done tremendous work to make sure that Pennsylvania has access to a healthcare system where we get good healthcare. It's accessible, but it's also increasingly affordable. In 2015, I expanded Medicaid. This has always been an important thing for me. Under the Affordable Care Act, it opened up health coverage for hundreds of thousands of Pennsylvanians, I think 700 and some thousand, and still climbing. And I've advocated against any rollback of the ACA, which provides health coverage for more than 1 million Pennsylvanians between the expanded Medicaid and what people have bought on the exchanges. My administration has implemented collaborative and innovative programs to improve healthcare outcomes for Pennsylvanians. And earlier this fall, I announced a healthcare reform plan for Pennsylvania that will lower costs and focus on improving accessibility, equity, and value in healthcare for all. That's what we talked about just a handful of months ago. Now, in the midst of a global pandemic, it is more important than ever that we help Pennsylvanians get access to healthcare coverage. That's why my administration participated in the Get Covered Day on December 10th by issuing a proclamation and raising awareness to encourage Pennsylvanians who don't have health insurance to go to pennie.com. That's PENNIE.com to explore their healthcare options. Pennsylvanians who need health care next year can find many reasonable plans in Pennie. I know looking for health care can be confusing, or health insurance can be confusing, stressful, and even sometimes frightening if you don't know what you need or if you don't know how you're going to pay for it. But Pennie has a team, and the team is here to help. Pennie provides world-class customer service to help every Pennsylvanian truly understand their healthcare options, as well as providing information about financial assistance for those who need it. Pennie also works collaboratively with other programs in Pennsylvania to make sure Pennsylvanians can get the help they need when they need it. So if you need health insurance, go to pennie.com or call 1-844-844-8040. That's 844-844-8040. Do that today and learn about your options and sign up. even if you're worried that you might not be able to afford health coverage, talk to the folks at Pennie, and they might be able to help. We want every Pennsylvania to have health insurance. That's the goal. But you need to sign up now to make sure you don't have any gaps in your coverage. If you enrolled for 2020, you have until tomorrow, the 15th, to change or update your plan for 2021 on pennie.com. You'll be ready to start the new plan on January 1st. If you don't take action, you may be automatically enrolled for 2021, but you could miss out on new options for new coverage. So you might want to just check it out. Open enrollment, the time period when anyone can apply for health insurance, ends January 15th. We're a month later than the feds, but it's coming up fast, so don't wait. Go to pennie.com or call 1-844-844-8040 and sign up today. So thanks, and now Commissioner Altman, I'll put it back to you.
Thank you so much, Governor. I'm excited to share more about Pennie's inaugural open enrollment period. Pennie is a demonstration of Pennsylvania's dedication to identifying and implementing initiatives that drive down healthcare costs without sacrificing access or quality of care. Transitioning Pennsylvania to a state-based marketplace was an idea we had about 2 years ago, and it was an idea that was twofold: set up our own insurance marketplace and a reinsurance program at the cost of what Pennsylvania was spending on healthcare.gov. A state-based marketplace allows for more efficiency and more investment in the things that matter. Pennie allows us to personalize customer service, outreach, and marketing campaigns that understand our own Pennsylvania communities, challenges, and opportunities. All insurers currently offering coverage in Pennsylvania will continue to provide plans in 2021, and now is the time to shop for those plans. With an average statewide decrease, that's right, decrease, of 3.3%, for premiums this year, Pennie customers have even more options that meet their needs and their budgets. Pennie strives to support all Pennsylvanians and understands that many who lost employer-sponsored coverage as a result of COVID-19 may be new to the individual market and unaware of the benefits of the marketplace. All commercial, comprehensive health insurance available in the Commonwealth, including plans purchased through Pennie, fully cover the COVID-19 test if patients are experiencing symptoms or have an indication of exposure, treatment for any symptoms that develop due to COVID-19, and the full cost of the COVID-19 vaccine once it is available to you. Again, I would like to shed light on the importance of the deadline tomorrow. Customers who wish to have continuous coverage in 2021, starting on January 1st, should enroll with Pennie by the deadline tomorrow. I want to thank you for allowing us to share with you the importance of the creation of Pennie in Pennsylvania. We are excited to better serve Pennsylvanians and to move the needle on driving down healthcare costs for individuals and families. Now, Pennsylvania Department of Human Services Secretary Teresa Miller will be discussing the importance of health coverage more broadly and Pennie's no wrong door policy executed in collaboration with DHS. Thank you so much, Secretary Miller, for being with us today.
Thank you, Commissioner, and thank you, Governor, for allowing me to join you today. It's my pleasure to be here. Again, my name is Teresa Miller, and I have the privilege of serving as the Secretary for the Department of Human Services. Access to health care, be it going to the doctor for a routine checkup or screening, getting care or medication if you're sick, or longer-term treatment for a more intense or chronic condition, is absolutely essential. The Department of Human Services administers most of what is considered to be Pennsylvania's public assistance system, including programs that support and facilitate access to health care and other essential needs for more than 3.1 million Pennsylvanians. These programs exist so that in our most difficult moments and periods of life, we have what we need to meet these most essential needs. Despite historic unemployment, we've seen a slower than expected growth in enrollment in Medicaid. In order to better connect people who may qualify for assistance due to a job loss or income change to these programs, we're working with the University of Pittsburgh to better understand why folks may not take the steps to apply for assistance through Medicaid. At this point, preliminary data from this survey is still being analyzed, but we're finding that people most often don't want or feel that they need assistance or believe that they'll be employed again soon. I think all of us want anyone who's experiencing a serious life disruption to land on their feet quickly and comfortably. But I don't want anyone who is still unemployed and looking for a job to feel like they have to endure this period and its stress, anxiety, and uncertainty alone. And we cannot risk going without care or financial difficult situations by going uninsured or without coverage while looking for a new job. I urge all Pennsylvanians who need health insurance coverage to go to pennie.com. Again, that's PENNIE.com, and explore your options ahead of the December 15th deadline. Pennie makes the healthcare shopping process easy for Pennsylvanians and helps connect those who could qualify to other healthcare programs administered by DHS, like Medicaid and the Children's Health Insurance Program. Access to healthcare is among our most essential needs, a necessity amplified by our current crisis. If you are currently uninsured and need healthcare coverage, please don't gamble. Take time to explore your options and be prepared as we head into 2021. Your health and well-being are too important to take this risk, and there are options available. Visit pennie.com and choose a plan before the December 15th deadline so you're covered going into the new year. Thank you again, Governor Wolf and Commissioner Altman, for allowing me to join you today. And I now have the privilege of introducing Zach Sherman, who's Executive Director of Pennie. And I just want to say a huge thank you, Zach, for all the work you've done to get Pennie up and running. Thank you.
Thanks, Secretary. Thanks for your support, collaboration, and leadership throughout this year. Good afternoon, everyone. I'm Zach Sherman, the Executive Director of Pennie. It's a great honor to be a part of this panel of state leaders today and to hear their dedication to improving the health and well-being of the Commonwealth. I wanted to start again by emphasizing the important deadline tomorrow. If customers want coverage that begins on New Year's Day, the deadline to enroll is tomorrow, Tuesday, December 15th. The website, again, is pennie.com. That's PENNIE.com. In anticipation of a surge in interest and activity, we have decided to extend the call center hours for our deadline tomorrow. The call center will be open from 8 a.m. to 10 p.m. Extending these hours is just one of the many benefits of running a state-based marketplace. We have the flexibility to better react and serve Pennsylvanians. It really goes without saying that this year has been difficult for us all. Pennie wants to help eliminate a bit of that difficulty, especially when it comes to navigating and purchasing health insurance. So let me put this as plainly as possible. If you do not have health insurance through your job, come to pennie.com and we'll make sure you get the coverage that is best for you and your family. Particularly in these unprecedented times, we know there's a need for coverage. So far, nearly 310,000 Pennsylvanians have renewed or actively enrolled in coverage through Pennie. 40,000 Pennsylvanians have signed up new, and through Saturday, we have taken over 100,000 calls. We are really pleased with the number of Pennsylvanians who've already taken the initiative to get covered to protect their health and well-being, and only expect this number to grow today and tomorrow. We're also not just online or over the phone. Pennie has a robust outreach and enrollment assistant effort that's available throughout open enrollment. Customers have the ability to schedule in-person or virtual one-on-one appointments with Pennie assisters and brokers. And we've also held and scheduled dozens of outreach and enrollment activities, events throughout open enrollment. We know applying for and enrolling in health insurance can be complicated and overwhelming, and strive to provide assistance and support to customers in the way that is most comfortable for them. Whether it is online, over the phone, or in a one-on-one setting, Pennie is here to help. Again, tomorrow is the final day that customers can purchase health insurance plans for coverage that begins New Year's Day, and our call center will be open tomorrow until 10 p.m. Our phone number is 1-844-844-8040. You can enroll at pennie.com, that's PENNIE.com, until midnight tomorrow night for coverage effective January 1. Nearly 1 in 20 Pennsylvanians are without health insurance. We strongly encourage anyone who's uninsured and seeking coverage and potentially financial help to pay for it to go to pennie.com or to call the Pennie call center to enroll in one of the high-quality options available in your area. Thank you for your time today, and a special thanks to the governor and my fellow speakers, all without whom we would not be where we are today in providing accessible and affordable health coverage to the people of Pennsylvania. We will now open it up for any questions.
Thank you, Zach, and thank you to all of our speakers. We're now going to open it up to questions. Our first reporter, and we would ask that you stick with the on-topic questions today. Our first reporter is Jim Melwert from KYW. Go ahead, Jim.
With that warning, I'll try to make this as tangential as possible. You did talk about COVID-19 coverage. That was a twist there. But Governor, I do want to ask you, you were mostly asymptomatic, and it appears that that your testing caught the virus at the tail end of your infectious period. Can you talk about the importance or what an expansion of rapid testing could do to catch that asymptomatic spread?
Yeah, I'm not. The rapid testing would certainly help, but also more testing. I mean, we're up to 80 or 90,000 tests a day in Pennsylvania, but for so long you couldn't get access to a test unless you were symptomatic. I was not symptomatic, and so I really couldn't have access to a test. When I finally did, we got to the point where you could actually have broad testing. I found that I tested positive. So I think what it showed is we need to make sure that we continue to ramp up our ability or capacity for testing. The rapid response test, I think whether it's rapid response or the PCR tests, we need to get results quickly. As you'll recall, we got to the point where we were taking up to a week or even 2 weeks in some cases because some of the national testing services were being overwhelmed by what was happening in places like Florida and Arizona and Texas, and we were paying the price for that. So there was a great range of time frames in terms of getting results, and the longer it took, the less valuable testing became. So I think in my case, what it showed is we need to always make sure that we get test results quickly so that the results are relevant. But we also need to have enough tests so that anybody can get a test, because it's sometimes you just don't know you had it. So I'm out of quarantine. My wife is still in quarantine for another day. We've quarantined ourselves, but I'm feeling great. So thank you for asking, and I appreciate the question. And let me just say, Zach, since I'm on, thank you for the work that you're doing with Pennie. This is making a big difference, and I think we sort of stepped on the line that in its first year, people are actually getting a reduction in health insurance premiums. It's not a reduction in the rate of increase; it's actually a reduction in health insurance premiums. When's the last time anybody heard that? And so it's remarkable work, and the hope is that we can continue to do that as we keep finding new ways to make this available to all Pennsylvanians. It's affordable, it's accessible, and I thank you for everything that you and your team are doing. Sorry, Sarah, back to questions.
That's okay. Thanks very much, Governor. Next up, we have Flora Pastorero from PennWatch. Flora, you should be able to unmute.
Yes, thank you. I'm wondering if we could go over the numbers again very quickly. How many people are enrolled in Pennie? How many new cases do you have of people enrolled? And you talked about people who have fallen through the cracks. How many people are missing out on this program who don't know about it?
Sounds like Zach, that sounds like a question for you.
So the numbers are again, and remember, there's the deadline to sign up for coverage for January 1st is tomorrow, December 15th. And as a result of transitioning to a state-based marketplace, we've given Pennsylvanians an extra month to sign up for coverage. So there's still plenty of time for people to come in and get enrolled. But so far, 310,000 Pennsylvanians have either renewed in coverage or actively come in and signed up. Of those, about 40,000 are new customers, totally new. And in terms of your last question, we've worked very closely with the Department of Human Services, with Secretary Miller's office, to ensure people transitioning between our programs don't fall through the cracks and have an easy and customer-friendly pathway from coverage through the marketplace to coverage through the Department of Human Services and vice versa. So we're working real hard to ensure that people don't fall through the cracks. So far, I think we've sent 30,000 applications over to the Department of Human Services that have come to us. So we've been very excited to see that activity.
And just as a follow-up question, Governor, I believe you said that there's actually a reduction in health insurance. Can you give an example of how much a premium has gone down and maybe how much the average person is saving on their
I think
health
it's three. I think it's 3.3%, but I'll let that maybe Commissioner Altman can give us the exact figures. Am I right? 3.3%.
Governor, of course, you're always right, but you got that fact right too. So we have a 3.3% statewide average decrease in premium for the individual market in Pennsylvania. And so because that is a statewide average, it's going to depend on what county you live in, on what insurance company that we're talking about in terms of what a given consumer might actually experience in a decrease. And of course, in this market, on the individual marketplace, well over 80% of people in this market also receive financial assistance to help pay that premium. And so I'm hesitant to throw out a specific number, but if you want to follow up with my office after this about a certain region or what's available to a certain person in that region, we're more than happy to help get those numbers for you. But it is difficult to do a broad brush on an actual premium amount because of that variation. But yes, the governor is correct, 3.3% on average premium decrease compared to last year.
And just very quickly, in terms of dollars and cents, what does 3.3% represent?
I'm trying to do some math there in my head, but again, because the underlying premium can vary a lot depending on where you live, how large your family size is, how old you are, it's very difficult to pinpoint a precise dollar amount for that number, but you are talking, maybe $50 a month. Depending again on those factors. But I'd be happy to work with you after this on some very specific examples of, say, a family of 3 in Dauphin County who makes this much a year. I think that would help perhaps put some more specifics to it.
Thank you, Commissioner. Next up, we have Paul Go from Pittsburgh Business Times. Paul, you should be able to unmute.
Hi, can you hear me okay?
Yes.
Hi. Okay, great. Thank you for taking the time. I have 2 questions. The first would be, you talked about the enrollment numbers, but is that, what percentage you've been able to retain from the current year, and also the new growth compared to last year? That's my first question. The second one after.
So to confirm, the question is how many transitioning customers from 2020 from healthcare.gov have we been able to retain?
And then new this year for next year.
So it's almost 270,000 have either automatically renewed or actively come in and selected a new plan, and then new customers is just around 40,000 and growing and counting.
Is there a percentage up or down of the retentions, like the percentage of you've retained, and then also a percentage of new, like compared to this current year?
Gotcha. So as a percentage, I can't do the math in my head, but I think about we started with about 280,000 customers renewing, and every year you see, as you rerun eligibility, people have picked up coverage through their employer, or their income has changed and they've transitioned to the Medicaid agency. So You don't expect to, on any given year, you don't expect to retain 100% of renewing customers. It's somewhere in the range of 80% actually. So I think we're above that at this point in time.
Thanks, Zach. And then the other question I had was, can you talk, Secretary Miller talked about how many more people had been expected to enroll in Medicaid due to the large numbers of unemployment and then economic economic downturn. Can you talk a little bit more about what you would expected and then how that is actually carried out in numbers? Because it's true. I mean, I've seen that with some of the other company numbers about what might be going on.
Sure, and I don't have the numbers, I don't think, right in front of me, but we can definitely get it to you. What I can tell you is, when the pandemic hit, we had from that point on expected at some point to get a huge influx and just see a lot of people needing Medicaid, people who had lost their jobs, people who had lost hours. We really thought we would see a huge spike. And as I've been reporting for the last several months, we have not seen that huge spike. What we have seen is a steady increase in our enrollment. And so we're 10%. I know we're 10% up. And I just don't have the exact dollar fit or the exact number for you, but we can get you that. I think it's a couple 100,000. So I think one of the, I think there's lots of things going on here, but I mentioned the study we did with the University of Pittsburgh because we were trying to understand why are people not coming to Medicaid? And I think some of the reasons are they didn't want to, they didn't see the need to. In a lot of cases, people felt like they were going to be employed soon, or they were going to get hired back, or their hours were going to be bumped up. So I think that's some of what we've started to hear from people as we did the survey of why we haven't seen a bigger increase. But we certainly have seen a steady rise in the number of people covered through Medicaid.
Thank you, Secretary. And next up, we have Tim Studeldreher from One United Lancaster. Go ahead, Tim.
Thank you. For number one, you talked about efficiencies shifting to Pennie. I'm wondering in future years after 2021, you expect costs to lower than what they would be under the CA marketplace. Also wanted to ask about your marketing and outreach efforts, and in particular, what nonprofits who serve low-income populations can do to bring people into the Pennie program.
So you kind of cut in and out there. I didn't quite catch either of the questions. I'm sorry. Can you say them again?
I apologize. First, long-term cost trends. What do you expect from Pennie? Will it continue to be lower than the Affordable Care Act, the marketplace?
Thank you for that question. So, of course, we know that healthcare costs continue to rise in this country, which is why what we're doing here is so important. And fundamentally, what we've done is we took the same dollars that Pennsylvania was sending to the federal government to run healthcare.gov on our behalf. And we are running Pennie so much cheaper that we can also invest money in that reinsurance program that is lowering premiums about 5% from what they would be otherwise. And I don't want to confuse that with the minus 3.3% decrease. That is the delta that the reinsurance program is resulting in from what we would have had without the program. And so long as we have Pennie, so long as Pennie will continue to operate more efficiently and only take a portion of the user fees that insurance companies pay into the program, we can continue to run a reinsurance program, and we will into the future, for as long as Pennsylvania decides to keep this program running, have lower premiums than we would if Governor Wolf had not worked so hard to pass and sign into law Act 42 of Pennsylvania. So hopefully that answers your question.
Thank you. Yes. And my second question was about outreach and marketing, and specifically what nonprofits can do to ensure their eligible clients enroll in Pennie.
Certainly. So another, the commissioner just mentioned, we saved a lot of money by doing this. We've been able to both invest in the affordability program to bring down the cost of health insurance in the individual market from what it would have been, but also to invest more in things like outreach and advertising and just broad communications to Pennsylvanians, insured and uninsured, to make them aware of what they're eligible for, how much financial assistance they can receive to pay for and enroll in coverage. So that's been a great benefit. We've vastly expanded our reach in terms of those outreach efforts, and we've expanded the in-person assister network through community-based organizations as well as health centers across the Commonwealth to give Pennsylvanians that one-on-one enrollment assistance that they may need. In terms of your question about nonprofits, if there are employees of businesses or nonprofits that don't have access to coverage through that employer, they can come to us, they can apply for coverage, and if they're eligible, they can receive financial assistance to help pay for it. We've seen most of our customers, nearly 9 out of 10 of them, receive some form of financial assistance to help pay for their monthly premiums, and in some cases to reduce the cost of their deductible, their copay, their co-insurance. And so far throughout open enrollment, we've seen for those that receive financial assistance that they're receiving a subsidy of over $500 a month.
Thank you. That is all the time we have for today's briefing. Thank you to Governor Wolf, to Commissioner Altman, Secretary Miller, and Executive Director Sherman for your time today. Thank you to all of our reporters for their questions. Everyone have a great rest of your day and stay safe.